one of the disturbing things as well is that we see people in the age group 10 to 14, right? And we can't always say that the infections they have is because of sexual intercourse. Because, as I said before, somebody could be taking medication. Let's say a young girl could be on medication that could interfere with the natural or flora of the vagina, and that could develop into some type of yeast infection, which is classified something like sexually transmitted. And that is because somebody could get it by other means, but they could pass it on sexually.
That was Ms. Judy Benoit, Health Promotion Officer within the Ministry of Health. As the Ministry of Health prepares to observe STI Awareness and Prevention Month this July, they are encouraging people to practice safer sex, as these infections are said to be on the rise: gonorrhea and syphilis. According to health officials, gonorrhea is one infection under close scrutiny, since it is said to be resistant to the traditional form of treatment.
But what we are finding is that gonorrhea, in its return, is now resistant to the regular drugs that used to treat it. So you go to the doctor, they give you a medication, you clear up your gonorrhea. Now we are being told that it is resistant to these drugs. So it means that we have to look for new drugs that is not accustomed to, that hopefully would treat it. We don't know how and when that would come, but with that situation now, it also means that we have to be more careful with our sex lives.
For the first half of 2016, 283 new cases of STIs were reported. STIs are spread mainly through sexual intercourse. However, it must be made known that not all infections manifest into sexually transmitted diseases. During the early stages, hardly any symptoms are shown. However, there are signs such as burning during urination, itching, colorful discharge from genital areas, sores around genitals, among other signs. Ms. Benoit said, once a person sees these signs, a visit to a physician is paramount. Waiting, she said, would only cause the condition to worsen to the point of causing damage to internal organs and eventually can lead to death.
And whenever a person sees that, they should hasten to get to the doctor, because early treatment is the key. Sometimes people wait and they might see it appears to be going away, like in the case of syphilis, for example, but it's not going away. Syphilis comes in stages. So when you think it's gone, it's really in you and it's doing damage to almost all of the organs and in the body. The brain, the lungs, the heart, the kidneys. It could damage every aspect of the body, and then it could end up in death.
The theme for this year's observance is Partners Together for an STI-Free Grenada. There will be interdepartmental activities throughout the month highlighting the importance of safer sex. Christelina John for GBN News.